All right, let me get going. As I said, my name is Verena Menek. I'm the Vice President of CAG, and I'll be moderating today's webinar. Just before we get going, I wanted to say a couple of things. First of all, let me remind you of the upcoming conference of CAG in Moncton this year. You still have time to submit abstracts. You have a little bit of time left, so please take advantage of that. And secondly, I wanted to just say a few words about the webinars in general. Essentially, we're trying to feature the recipients of CAG awards. As you know, CAG gives out a number of awards each year, and the recipients are announced at the annual scientific and educational meeting. But unfortunately, at that meeting, we really don't have the chance to hear from the recipients, and so the webinars are trying to give us a chance to hear from the recipients about all the wonderful work they're doing that led them to receive the award. Another reason that why we have these webinars is to help us promote the CAG Awards. So having said that, there are a number of awards given out each year. Some are for faculty members, some are for students. I'm not going to go through them, but I would encourage you to go to the CAG website to take a look. The deadlines are June, so there's still time to apply for those or nominate somebody. And particularly noteworthy is that this year we have two new awards that I wanted to make sure you know about. One is a mid-career award and a new investigator award. So again, applications are on the website, on the CAG website. All the information is on the website, and I hope you go check those out. What's available. So, and lastly, just before we get going, a few housekeeping issues. As Anthony, if those of you who heard him say this earlier, your microphones will be muted during the presentation, and that's just so we don't get echoes or static. If you have questions or comments, please put them in the chat box. If the chat box is not open on your monitor, you just have to click on that little bubble that shows up, and then you can type in your comment to the group. I will monitor the questions, and then we'll take the questions at the end of the presentation. Also to note that the webinar is being recorded and will be available later on the CAG website. So if you know somebody who was not able to make it, you could refer them to the website. So with that preamble, I'm delighted to introduce the two speakers of this webinar. Dr. Jenny Ploeg is a professor in the School of Nursing at McMaster University, and she's also the scientific director of the Aging Community and Health Research Unit. She is the 2018 recipient of the CAG Recognition Award for Excellence in Student Mentoring in honor of Evelyn Shapiro. And our second presenter is Dr. Esther Coker, who is a clinical nurse specialist at the St. Peter's Hospital site of Hamilton Health Sciences, and she's also an assistant clinical professor in the School of Nursing at McMaster University. She completed her PhD under the supervision of Dr. Jenny Ploeg, and as she says in her bio, she continues to enjoy a mentoring relationship with Jenny. So with that, I will turn the mic over to Jenny and Esther.
Great. Thank you very much. Can you hear me okay?
Yes, I can.
Great. So thank you, everyone, for coming to listen in and to share our discussion today. It was truly a great honor and a surprise to receive the CAG Award for Mentorship. And so extending that great honor, I invited one of the people who nominated me for that award, Dr. Esther Coker, to help me with the presentation today. So again, it's a great honor to be here today and very pleased to share some thoughts with you. So today, Esther and I are going to share this presentation, and I'm going to start with an overview of our Aging Community and Health Research Unit. And this is the context within which our mentorship occurs. I'll describe some of the strategies that we've used to develop capacity in aging and health services research, and highlight some of the work completed by our trainees. And then Esther is going to describe some of the mentorship strategies that promoted her success and highlight some of the work that she completed as a trainee. And finally, both Esther and I will talk about some of the lessons that we've learned about research mentorship in our journey this far. So I really encourage you to take a look at our website of our Aging Community and Health Research Unit. It provides quite a bit of information about the unit itself, but also about our trainees, of which we have a number. And so under the Education tab, there's quite a bit of information there about our trainees. The Studies tab gives information about the studies that we've completed. We have a very active patient and caregiver engagement strategy, and you can see some of those people under partners. And so it's quite a good place to get some information about what we're doing. I'd like to acknowledge the people who are co-scientific directors with myself of the unit. Dr. Maureen Markle-Reed, who has a Canada Research Chair here at McMaster, and Ruta Velitis, who also has a chair in primary care here at McMaster. So our research unit started back in 2013. And we were very fortunate to receive some funding both from CIHR, the Community-Based Primary Healthcare Signature Initiative, for a teen grant over 5 years, as well as then the Ontario Ministry of Health and Long-Term Care Health System Research Fund. So many of the things that we're talking about today really arose in part thanks to the funding of those organizations. So our Aging Community and Health Research Unit has a number of goals. The first is to promote optimal aging at home for older adults who have multiple chronic conditions and to support their family and friend caregivers. Another one is to co-design, implement, and evaluate interventions to achieve the quadruple aim outcomes. So improved health outcomes, improved patient experience, improved provider experience at less cost. We're also looking at how to scale up effective interventions and how to build research capacity. So all of those are some of the goals of our research unit. Much of the work that we're doing aligns with the Strategic Patient-Oriented Research Initiative. And so we're very involved in meaningfully engaging patients in research, better addressing patients' needs by increasing the relevance and translation of health research, and improving health outcomes and healthcare system outcomes. So the key principles of our unit are these. We use a collective impact approach. In other words, have meaningful engagement of our knowledge users. So not only our patients and caregivers, but also providers, as well as decision makers and policy makers. We're actively co-designing complex, integrated, and person-centered interventions for older adults who have multiple chronic conditions and their caregivers, and using innovative research designs and methods to evaluate not just the outcomes of the interventions, but also the implementation, what works and what doesn't in real-world settings. So in our research unit over the past number of years, we've conducted 14 studies, or are currently conducting some of those. So, and they have really ranged from everywhere from study 1, which is a very qualitative study of older adults, caregivers, and providers of older adults in terms of their perceptions about what are the challenges and facilitators of managing complex conditions. So this was a large study conducted in Ontario and Alberta, and it involved over 120 people who were interviewed as part of the study. The next study, I'm just giving you some examples of the kinds of studies that we've conducted, because it is within this context that our trainees receive their experiences. So the next one is looking at the correlates and health outcomes and costs associated with multiple chronic conditions. So this study involved looking at administrative databases and looking at some of the factors that are related with use and costs of health services. Another one was a longitudinal study of caregivers of older adults who have multiple chronic conditions, led by Dr. Allison Williams and Wendy Duggleby. Another one was looking at a mobile health technology. We've looked at interventions, transition interventions for caregivers of people who've had Alzheimer's disease and multiple chronic conditions. We've done interventions for stroke, looking at My Stroke Team, using mobile apps as well. We've looked at the Health Links Caregiver Evaluation Study here in Ontario. We've looked at online interventions for family caregivers. we're now doing a large study across Canada around a community partnership program for diabetes. So there's a wide range of methodologies here, as well as kind of topic areas that students have had a great opportunity to be involved with. So over the past about 9 years, we've had over 60 trainees who have participated in our Aging Community and Health Research Unit. And so we've very actively involved undergraduate students, graduate students, postgrad, as well as new investigators. They have come from diverse disciplines, so not just health sciences, not just nursing, but a whole range of different disciplines, including economics, business, engineering, and they've come from various universities across Canada who we have partnerships with. The trainees, as much as possible, we've tried to integrate them into all aspects of the research program. So that involves developing protocols or grant applications, implementing studies. Some of our trainees right now are helping provide training for a new intervention for our partners in Quebec, PEI, and Ontario. They've been very involved with data collection and analysis, writing reports, presenting results, and publications. So some of the kind of topic areas that our trainees have had opportunities to be involved with include designing, implementing, evaluating, and translating new health care interventions. In terms of health services research, a very broad range of topic areas, so older adults who have multiple chronic conditions, their family caregivers, qualitative, quantitative, mixed methods research. We've conducted a number of pragmatic randomized controlled trials. We're doing quite a bit of work on analysis of administrative databases involved with sex and gender-based analysis and looking at integrated knowledge translation. We have a very active component of our work that involves patient and public research partner engagement and evaluation of their experiences in being involved in research. And we're also working with multidisciplinary teams and decision makers. So some of the things that we've purposely and strategically done to support our trainees is develop formal and informal mentorship relationships, involve them in stakeholder meetings. So we have over 100 stakeholders who we have met with on a regular basis, and those have included patients, caregivers, decision makers, and researchers, and receiving input from them in terms of our direction for our research program. We were one of 12 teams that were funded by the CIHR Signature Initiative across Canada. And so every year, those 12 teams met, and so we facilitated the attendance of many of our trainees at those meetings. And so they had the opportunity to network not just with the researchers, but also other trainees. And in fact, some of our trainees are actually writing a paper together for publication about their trainee experience. We've certainly provided training on patient engagement opportunities and provided lots of opportunities for our trainees to lead or co-lead authorship of papers, reports, research briefs, and presentations. We've profiled our trainees on our ACHRU website and through the media. We've included many of them on grant applications. We've built in funding for trainees into all of our budgets. We provide trainee funding for them to work in ACHRU, attend conferences, technology supports for software, for example. As most of us do with mentorship, we identify possible sources of funding, encourage our trainees to apply, review their grant applications, write letters of support. We are in a unique position in terms of being able to include on their grant applications often in-kind supports from our Aging Community and Health Research Unit. So we have a number of support staff who will contribute to the work that students are doing. And then really trying to focus more on trainee career development, recognizing that they will, at least for graduate students, they won't be a graduate student forever. And so we need to start working with them and planning for their future. So one of the unique strategies we've used is a capacity building seminar. And this has been linked with Maureen Markle-Reed's Canada Research Chair Seminar Series. So this has always been led by our trainees. So right now, two of our trainees, Anna Garnett and Melissa Northwood, PhD students are leading this. And so they develop the topic areas in consultation with the other trainees who are part of ACHRU. They identify people who might be able to lead those seminars. They facilitate those seminars. They provide mentorship on a whole range of topic areas. And these seminars are often open beyond just themselves. So I'm going to give you a few examples of some of the work that our trainees have done, because I think it's interesting, and as a mentor, I'm very proud of what they've done, but it also gives you some examples of how they've kind of built on some of our work, as well as continuing with their own. So Melissa Northwood is a PhD student, and she's nearing completion of her PhD now. And she's really done some fabulous work in relation to understanding the complexity of living with diabetes and incontinence for older home care clients. So that lists her committee members. So she's doing a mixed method study, and her some of her questions are: among older adults with type 2 diabetes receiving home care, what is the prevalence of urinary incontinence? What are the sociodemographic, psychosocial, functional, and clinical characteristics associated with urinary incontinence? So those are very quantitative approaches using the RAI database. Then she's looking at how are type 2 diabetes and urinary incontinence experienced by older adults who receive home care services, and how do nurses care for this particular population? So she's right in the middle of doing analysis right now. She's actually written draft reports of some of this data, so I'm sure her results will be submitted before too long. So she's actually done the interviews with the older adults and the home care nurses and analyzed those using interpretive description. She's done analysis of the RAI home care assessments of about 125,000 individuals with type 2 diabetes receiving home care. And so she's done those two sets of analyses somewhat separately at the start, and she's now looking at converging that information. So one of the key pieces of work that she's produced, which I think is really important, is she conducted an integrative review of the social determinants of health in older adults with multimorbidity. So she looked at a lot of literature and recognized that there really is very little focus in the literature on multimorbidity around the social determinants of health. So social network support, financial support, and some of the other issues that we seldom recognize. But we also know that for older adults with multimorbidity, these are absolutely key issues that must be addressed in terms of promoting their optimal aging at home. So it's a lovely piece of work. I encourage you to take a look at that. Another trainee is Mary Lee Yu. She started with me as a master's student, and she's now a PhD student. And so she took a slightly different track in her research. Her interest has always been around older adults who have responsive behaviors associated with dementia. So she looked at what are nurses' experiences caring for these individuals, and also their perceptions of education to help them better support people who have responsive behaviors with dementia in acute care. And so her research questions were: what are nurses' experiences in caring for this group on acute medical units, recognizing that acute medical units are often triggers for these behaviors? What are the perceptions of healthcare professionals about this particular education that many of you have probably heard about, and its impact on their practice? And what are their recommendations for improving dementia care and this type of education in acute medical units? So again, she's just amazing, one of the amazing people that I work with. So she just defended last August, already has one paper published and one paper accepted of the results of this. And really interesting findings in terms of the challenges of actually integrating this type of education into the care that nurses and other healthcare professionals actually use in the acute care settings, and the complexity of many of the issues that they have to deal with. So I really encourage you to look at some of that work. So Esther is another amazing individual that I've had the opportunity to work with along her PhD journey. And so she has a little story to tell about some of her experiences and her lessons learned.
Thanks, Jenny. Um, Getting ready for this presentation has really allowed me to take a great little reflective trip down memory lane. And while I was preparing, I noticed that there's no shortage of resources on the internet these days related to mentorship and supervisory relationships for PhD students and supervisors alike. But I'm going to share what I consider to be the outstanding elements of my relationship with my supervisor turned mentor, Jenny. As I mentioned in my letter of support for Jenny's nomination, which you haven't seen, she is a world-class expert in the field of gerontological nursing and qualitative methodology. She's cringing over here. And these were my two main areas of interest when I was thinking about entering the PhD program. But I'd been contemplating for many years, actually. But the one thing all along that I did know was that Jenny would be my choice for a supervisor if that day ever came. And then, through a series of strange circumstances, she learned of my interest in entering the PhD program, but I was still really unsure about taking that plunge. And I recall that Jenny was right there for me in that first of many forks in the road, and spent time helping me to decide whether this would be right for me. And it was such a supportive gesture at the time, and I've felt that consistent support from Jenny ever since. In addition to being there for me at all the forks in the road, Jenny also helped me navigate my way through the program. One of our early decisions was the configuration of my thesis committee. Dr. Sharon Kozalainen had already come on board, but we needed a third, and Jenny recommended Dr. Anita Fisher, and I really couldn't have asked for a more supportive threesome in those early days. Ultimately, Anita had to leave my committee, and Jenny went to bat once again to help me find just the right match, Nancy Carter. Jenny also helped me navigate my thesis topic itself. I remember back then that I was struggling a great deal with settling on a topic, and this had actually held me back from applying to the program. So Jenny sat me down and began by helping me identify two very general areas. I'll never forget the way she did this. She was sitting in that chair right there, and she helped me come to the realization myself. She said, "You've already told me that you want to study something related to frail older adults. And because your role involves implementing clinical practice guidelines, you want to do something related to a set of practice guidelines." So she picked all of that up. I'd already had some opportunities to dabble a bit in pain and falls research, and I was feeling like I wanted to study something that for me would be new and fresh, and something that nobody else at the hospital where I worked would be waiting for, so there wouldn't be any pressure. And in conversation with Jenny, we landed on oral health, and specifically oral hygiene care. I'd recently learned that this area of nursing practice was suffering somewhat, and I saw that in my own clinical work. And this had prompted me to do a fair bit of reading. I was particularly inspired by some recent work at that time by Min Yoon and Katrina Steele, who'd published an article about the link between oral care and pneumonia, and my eyes were wide opened. I noticed that there was only emerging research at the time, and there were few nurses studying this phenomenon. The phenomenon being that we as nurses don't do a great job of ensuring that patients' oral hygiene care is completed, even though it is a much more important thing than we once realized. Now, while I was still in my coursework phase, Jenny helped me design an independent study course. I needed a fair bit of direction at this stage, and she was pretty clear about her expectations. One of the outcomes of this course, Jenny insisted, should be a literature review that, with some further work, could be a publishable paper. So I thought, well, that's a bit daunting, and I was right. But once the course was finished, there was so much help from my committee to turn that assignment into a systematic review. It took a lot longer than I thought it might, and I had to do some backpedaling, but I found myself taking a leadership role and convincing my committee members to become involved in some pretty tedious work over a summer. Jenny is chuckling, she remembers that. And it finally happened. It was published in Research in Gerontological Nursing. In this study, we'd examined the effect of intervention programs designed to enhance the ability of nurses to improve oral hygiene outcomes in frail older adults. All the interventions we found were educational in nature, and they consisted of either single in-service education sessions or single in-service education sessions supplemented by a train-the-trainer approach, or education sessions supplemented with ongoing active involvement by a dental hygienist. And it turned out that none of the approaches emerged as being desirable over the others because methodologically strong studies were lacking. Jenny continued to motivate me through the phase of my studies where I was preparing for and writing my comprehensive exams. The preparation involved writing outlines, and during this phase, Jenny and the other members of my committee provided lots of feedback. And at the time, we talked about the value of feedback, and my committee members let me know what I could expect. I received frequent feedback. We met regularly. There was a nice mix of positive comments and critical comments, and it felt sincere. It was two-way. Feedback was a conversation, not a lecture, and I felt motivated to act on that feedback. And at each of our meetings, both our one-on-one meetings with Jenny and myself and our full committee meetings, Jenny finished each meeting with words of encouragement as she celebrated every milestone with me. It was meaningful at the time, and it's even more meaningful in retrospect. As I entered the writing phase, I did so very, very confidently because Jenny had helped me feel very prepared. More than ever, it was during this time in preparing for my comprehensive exams that Jenny connected me with former students and other experts who were able to offer advice about how they made it through, and I got lots of really great advice. I came to another fork in the road just after that when I was, I guess, more in the mood to publish my comprehensive exam papers than I was to proceed with writing my thesis proposal. I kind of felt at that time that I needed a break after all of that, and I wanted to maintain the momentum of the comprehensive exam study. So Jenny agreed to this little detour, and with the help of Jenny and my other committee members, we were able to publish both papers for my comprehensive exams. The first paper reported a concept analysis of oral hygiene care and concluded that clarity around that concept of oral hygiene care as a nursing intervention could potentially enable nurses to impact oral health outcomes and possibly prevent systemic diseases in older patients. The second article, because I plan to use observational methods to study oral hygiene care, this second article reported on an integrative review of the literature that was undertaken to critically analyze how rigor was ensured in qualitative or mixed method studies where observational methods were used. In those cases, to study nurses as they provided basic nursing interventions because there hadn't been anything related to oral hygiene care in the literature at that point. And then, of course, during the thesis writing phase, Jenny constantly provided feedback and offered advice and motivated me and connected me with resources. But I have to say that in retrospect, the thing that had the most meaning was celebrating those milestones. And we continued celebrating together right up until the day of the defense, when we had a beautiful celebratory lunch. Check out that place. It's beautiful. And on the day of graduation, when we celebrated the finale. But Jenny's work was not over after graduation. She supported me in the publication of 2 articles based on the thesis. The first article had a few findings. It reported that nurses, firstly, often convey oral hygiene care to their patients as being an optional thing. We also found that nurses are inclined to preserve patient autonomy in oral hygiene care, maybe even over ensuring good oral hygiene care having happened. We found that oral hygiene care is often spontaneous and variable and may not be informed by evidence, very nurse dependent. And clearly, oral hygiene care is not embedded into bedtime care routines, as it should be. The second article reported that patients' oral hygiene care was supported in just over 1/3 of patient encounters with nurses. Denture care was inconsistently performed, and it was very infrequently followed by care of the oral cavity, which is so important. Nurses did not encourage adequate self-care of natural teeth by patients, and they very infrequently moisturized tissues. So we concluded that evidence-based oral hygiene care standards are required to assist nurses to support patients in achieving optimal oral hygiene outcomes. So Jenny and I continue to meet regularly to celebrate our friendship, and in fact, we're just embarking on a small study to further explore one of the findings in the research study reported in the thesis. We're going to be looking at patients' experiences with relying on others for oral hygiene care, get their perspectives. And so, just to summarize, I think that the lessons that I learned and have learned through our association is that you need to be purposeful in nurturing the relationship. I don't know how purposeful we were. Some of it kind of just happened. But I think if I were giving advice to others, I would say be purposeful. Feedback needs to be a two-way conversation. Gosh, that was so important. Take some chances. Try new things. Throw out new ideas. They often come to fruition. Publish together. It's so much fun. And celebrate often.
Great, thanks, Esther. So I asked both Melissa and Mary Lee to write down a few of their lessons learned in the mentorship relationship as well. So I'll just present a few highlights of what they've said. So Melissa said the availability and openness are really important, and to meet regularly and provide timely feedback. She also said the encouragement and critique both together. So for a mentor to highlight student successes as well as challenge with critical feedback. She said the learning opportunities were most valuable. So I invited Melissa to participate in a number of projects. We wrote a number of papers together, and really most recently even, I provided mentorship to Melissa on how to deal with multiple comments and feedback from other authors on a paper that sometimes were quite contradictory. Melissa said it's really important for mentors to view and treat the student as a whole person, to be a sounding board for the challenges that they often face outside of school, their work-school balance, aging parents, asking about family, leisure, and well-being, the importance of providing structure to mentor other students. So Melissa and Anna were two people who took on the capacity building committee responsibilities, but then they in turn mentored others. So one of the key things that I learned about mentorship many years ago is you don't wait to be mentored in order to mentor. Most of us have many skills, abilities, and experiences that we can share with others that are really valuable as we mentor other students. And we've seen that so much even with our undergraduate students who continue to mentor each other and others. And then Melissa's final point, which I thought was lovely, was joyful engagement. So sharing the joy of being an academic in all roles, teacher, researcher, mentor, and author. So I have to catch myself on this because I'm not sure that I'm always joyful about some of the things that I share, but it tells us as research mentors how important it is to be joyful about the opportunities that we do have and the rich experiences that we have to share. Mary Lee shared these lessons. She said, receiving strong mentorship when collaborating in research projects within a safe learning environment is very important. And especially for people who maybe are less experienced, to be in a safe learning environment is absolutely key, to be valued for who they are and what skills and abilities they bring. Mary Lee also noted how valuable it was to have multiple opportunities to network with researchers and graduate students, locally and nationally. And so to bring people together in different kinds of opportunities and different venues is absolutely key. Mary Lee said that mentors at ACHRU ensure that trainees are immersed in diverse projects. So this is very much true. Mary Lee right now is helping us with some of the training for one of our research projects. She actually came with us on a site visit to Quebec. And this was one of her first kind of initiatives like this of going out on her own without other supports, but with a team to learn from another site. And because she speaks French very fluently, probably better than any of us, she was absolutely key in that role. So not only did she receive a benefit from that, but she made a major contribution to our work there. Mary Lee said that mentors focus on building the capacity of trainees in becoming future investigators and applying patient engagement principles. We know that CIHR and many other funders have absolutely, as one of the key goals, patient engagement, patient caregiver decision maker engagement. So we're very strategic about building those skills and abilities in our trainees. And then finally, Mary Lee said that she feels that she's part of the ACHRU team and belongs to an academic community. From my perspective, I took a little bit of time and just reflected back. And, you know, I have been so blessed and honored to work with such absolutely fabulous people. And so developing and maintaining relationships with these individuals who, you know, are trainees only for a short period of time in our lives, but then become colleagues. And in fact, some of them are good friends, like Esther. That's absolutely key. And it's such a rewarding experience learning together. I have learned so much more from my trainees, from my students, than I'm sure they will ever learn from me. And to recognize that, it's a learning together experience. And that was very much the case with Esther as well. Providing opportunities for growth, mentorship, and leadership. Again, there are lots of opportunities for our trainees to take on leadership roles within our teams, and to provide those opportunities is key. Many of our trainees, when they leave us in our research units, will be working with other people. So to facilitate networking early on is absolutely key. Providing funding letters of support. Many of the trainees that we have in our unit are nurses, and they can work as nurses and get a lot more money working as nurses than they can in a graduate program. And so whatever we can do to provide funding supports so that they can really focus on their studies, on their writing, on their scholarship development is absolutely key. A couple of my students most recently said, Jenny, you really need to be supporting us more in terms of our career planning. So I have really worked with students looking at what about your postdoc when you're done? What about your interviews for your faculty position? Should we meet and talk about what are some strategies for doing that? And I haven't done that early enough in people's careers. And that's something that I think we need to think more strategically about. And finally, celebrating success. Students have a tough role often in a graduate program, taking courses and all of the kinds of criteria that are needed, as Esther just said, comprehensive exams, defenses, and so on. And they do so much throughout a program. And it's so important to celebrate each and every success. Getting grants, publishing papers. And so it's a pure joy to do that. So that's kind of a summary of some of our respective lessons learned and some of the insights that we've gained over time. So it's been a pure joy presenting this and with Esther and talking to you today. So we'd welcome any questions or comments.
Thanks so much, Jenny and Esther. And I can see why you got the mentorship award, Jenny. This is fabulous. If anybody has a question, put it in comment in the chat box. If you don't see the chat box open, you just click on that bubble, that voice bubble on the right top side of your screen, and then it will open up. Brad has also put in the link to the awards on the CAG website. Brad is on the CAG board. Anyway, let me ask you a question, both of you, I guess. How do you prepare, or is the preparation different for students who do not plan to go into academia or don't have that clinical side to them? And I know this doesn't apply as well to you in nursing, but do you think the preparation is different And how would it be different? How do you prepare somebody for outside of academia or clinical work?
That's a really good question. I think there are differences. So certainly, some of the master's level students who come in, the ones I supervise usually are doing a thesis, but many of them plan on going into clinical work. So some of them aren't interested in in having a position at a university, for example. And so I think the expectations are maybe a little bit different in that we might not push them quite as much in terms of certain opportunities that are available, for example, being on grants and that kind of thing. All of the students, we do encourage them to publish. That's an absolutely critical goal, I think, because so much of our healthcare research work never gets published, and yet there are such important lessons learned and strategies to develop. So I think there is a little bit of a difference in that sense. Now, many of our trainees do have clinical backgrounds. Like I said earlier, many of these students are from engineering or business, and so they're not in the healthcare system. And so the kinds of work that they were doing in our unit were quite different. So, for example, one of the students from business, he was working on a costing manual to look at what are the costs of use of different healthcare services. So it's still healthcare issues, but the focus is not as much on clinical. So I'm going to ask Esther to just mention a little bit from her perspective about maybe the value of having a clinical background and coming into this. And Esther, I think, you have a clinical appointment, but an academic appointment, but your primary focus is clinical.
And that's right.
You always knew you'd be going back to that.
Yeah. So yeah, the clinical area is where I have come from and where I will stay. And really my need is to do clinically relevant research in my settings. And so I don't have the experience of not having a clinical background. I think that certainly it's helped me to identify areas of potential research in a way that would be very, very different for somebody who's not embedded in the clinical settings.
So yeah, I think do try and tailor the opportunities as much as we can to the unique interests of individual students who come, recognizing there are certain expectations. So whether you're a master's student or a PhD student, you are expected to publish.
All right, great, thank you. We had a question come in that is directed at you, Jenny. And the question is, how do you balance multiple roles, such as leading large research projects and mentoring students? And have a life beside it, I think, maybe? I'm adding that.
Well, that's an excellent question. I don't think I always have the life that I would like to have in terms of a bit of time on weekends and stuff. But for me, it always has been such a joy, such a reward to work with students like Esther and Mary Lee and Melissa and others. It's very, for me, to see one of my students have a paper published is just as rewarding, if not more so, than publishing one of my own papers, because you see their success. And so it's something that you spend the time trying to meet regularly with students and trying to support them. So right now I have 2 PhD students who are getting near the finish line of their PhD work. So we're getting lots of versions of 100, 200-page theses, and it's very time consuming. So you're right, it's a real challenge sometimes to try and balance the responsibilities of your research program as well as teaching with the demands on that you have with supporting any student. But again, I think it's just seeing that's such an integral part of my work. It's such an integral part of the success of any research program. And it's hugely rewarding. And you get to meet new people and you get to work with them. You learn from them constantly. Esther and I have had a number of discussions where, I really knew very little about oral care. and healthcare professionals' roles in that before I ever met Esther. But having read many of her papers and the drafts of her thesis, I learned so much. And it's a lovely challenge to grow and develop with students. So it's not an easy balance, but it's an important balance.
Okay, thanks. We have another question for you. Did how you were trained inform or influence the way you now mentor? So did you have any models, role models yourself? And is that why you became such a great mentor?
I'll have to say yes. I had a number of people who were very, very supportive of me during my training. So I'll focus on a few, particularly at the University of Toronto. So at the University of Toronto, I worked with Craig, Pringle, Irving Brutman, Wells, and all of them brought something unique to my PhD experience. And I was very honored to work with all of them. And Dot Pringle is just such an amazing mentor and support person. I remember Donna Wells invited me to her condo in North York, and on her walls were all of this paper that demonstrated the process of her analysis of her PhD work, and the willingness to spend time with people and share with them. I remember Dot, after I defended my thesis, invited us to a lovely lunch together. So the celebration thing, I think, is really important. And so, making sure that you celebrate with student success. So, yeah, I've been very blessed to have some great mentors, and I'm sure they have influenced me.
So that's great to hear. So in other words, great mentors beget other great mentors. So we have high hopes with all your trainees of having, you have another generation of great mentors coming.
That's right.
Is there any final comments from you? We have no other comments, further comments from our audience here. So any final words, Esther, Jenny?
I think just to underline the amazing experience I've had with Jenny as a mentor, and it just in follow up for your last question, I get a bit of feedback myself from my students about my mentorship abilities, and I know for a fact that it's because I've had in Jenny. I learned so much about mentoring from her, and it's really nice to be able to pass it along.
Mm-hmm.
Mm-hmm.
And I think CAG is a wonderful opportunity for so many students to receive mentorship. Like, all of the conferences that we've been to over the years, we've seen so many students come and be engaged. And I think more and more young individuals are joining CAG and seeing the advantages of being part of an organization that is so supportive and welcoming of students, and also provides such wonderful mentorship opportunities. So I just wanted to express thanks to CAG for all the great work that they've done in supporting students and all of us as researchers. So I think we never do it in a bubble. We never do it alone. We always do it in a context, like you've said, Verena, of other people who have mentored us, of other contexts where we can grow and learn and develop. So huge thanks to CAG.
And thanks for that. I do have another question that came in. By the way, if you don't see anything in the chat box, it's some questions are coming directly to me. So there's different options in how you can put in the questions. So here's the question for both of you. What are the pros and cons of being a mentor in such an established research unit? How do you think it might be different if you were training in a smaller, more informal research setting?
I think that's a good question. I think there's a number of advantages. So when I've been mentoring students for many years. So both before we had funding for this research unit and while we've had funding for the research unit. And I would say there are more advantages with the research unit. One of those is being able to provide funding to students to actually work with you on projects. Another is to have people in a research unit, such as an administrator or other statistician or other people who can support, who can provide that kind of expert advice to students that sometimes we on our own can't give. Certainly in this particular research unit, we were, as I said, one of 12 teams that were funded by CAHR. So there were wonderful opportunities every year and on an ongoing basis to meet with people from the other 12 teams across Canada, as well as some of those teams had international representatives. So one of those meetings, I think we brought 4 or 5, maybe 6 students, and it was attached to NAPCRG, the primary care conference. And so the students that we brought not only came to the one-day meeting of the 12 teams and got to network with other students, but they got to present their own work, their papers at the conference that was at the same time. So, and then to have the funding, to provide students funding to go to conferences. Like, I think having those kinds of supports in a research unit are absolutely key. I don't think it changes the nature of the intimacy in terms of relationships with students to be part of a larger research unit. I think it only adds to it. That's my perspective. That's an excellent question, though.
Esther, from your perspective, how would it differ if you had been in a smaller environment?
Yeah, my mentorship hasn't been within the context of the research unit, so quite different experience. I do see in my travels others who are part of smaller research units, and I wouldn't see that there would be much of an advantage to a smaller over a larger one, from what I've seen from other colleagues.
Mm-hmm. For Esther was working in her clinical role while she was doing her PhD. So probably for Esther, you know, there was less of a need for the funding support that the other students were more requiring from a research unit. But certainly, like working with Sharon Castelline, and Sharon was one of the investigators on the research unit. So Esther certainly had the opportunity to work with other investigators in the research unit.
All right, thanks so very much. I'll be ending the webinar. This was great, excellent information. Thanks to both of you for taking the time to share this information with us. Just a couple of closing comments. The next webinar, we're on a webinar blitz, as you might have noticed. The next webinar is Tuesday with our winner 2018 recipient of the CAG Award for contributions to gerontology, and that's Dr. Pierrette Gaudreau, who will be talking about, her title is From Animal Models to Older Adult Cohorts, Clues to Understand the Processes of Healthy Aging. So that's Tuesday, 12 o'clock EST. You still have time to submit abstracts to the conference in Moncton, and everybody wants to go to Moncton, I would think. And please do check out the awards on the website. There is still time to apply for those. Again, there are a couple of new ones that you definitely want to check out. That's the Mid-Career Award and the New Investigator Award. With that, good afternoon. Have a nice weekend, and I will close the webinar.